Thank you very much, Dimitri, and welcome everyone for this session. And it's so good to see the whole family together. It's always a pleasure. And today's my topic, given which I have been working since a few time now, is AI application and Bible interpretation. Just now, we had a beautiful presentation from Dimitri. He told, see, interpreting a Bible report from different angles is a challenge. I can be a specialist in meridian. One can be a specialist in Ayurveda. One can be a specialist in, different other anatomy, physiology, whatever it is. But the whole speciality is required for us to understand the functioning of the human body. Human body is a complex mechanism. As we are going to have one more presentation, which wherein even the teeth you cannot neglect. The teeth. As a clinical practitioner, I look the entire body. And till now, can any one of us question ourselves that after looking at the Bible, have we ever asked, did the patient had any dental treatment recently? Because that is also very important to understand in the interpretation part of it. Now, while we were looking at this, see, we can look the Bible report in the form of in the Ayurvedic concept, in the principles of meridians, very important. And of course, we have the organ system as well, which is presented in the Bible. But after getting the Bible, what are we supposed to do? We are supposed to give the solution. As a clinical practitioner, I have to give a solution to my patient. How would I give my solution? What is the angle of my uh, therapy which I'm going to do so that the patient's symptoms can be elevated? So here we started working with one of the important topics, introduction. Can we somehow make use of artificial intelligence? Can we make the knowledge of AI? Can we bring it into our Bible system and try to see that it will be a assistant for us in understanding the reports what you got from the patient? So I just begin by introducing this concept. This concept is a very well-known concept today in the world because majority of the system are now following artificial intelligence. Now, what is this artificial intelligence? Just we go brief between with that, and then we take it up with the reports. As you know, it is a computer science. It's a knowledge which is ever growing. Every time you start using AI, the knowledge of AI keeps on increasing. So we call it as a learning mechanism. It's one of the best known systems right now. And this learning mechanism, practically, if you see, we can bring it up in our centers, in our clinical practices, and try to get the information from the reports what we have, from the reports of Bible. Of course, let me tell you, it is an assistant. It is, of course, there are deep, when you go into the engineering of this artificial intelligence, you have definitely the knowledge, the data which is required, the machine learning program and the deep learning programs are all integrated into this. But we don't need to understand all of these. We need to understand how is this now included in our system, how it can be made use of in our system. So we know that Bible reporting is a data. We have certain data with us. And AI is very much efficient in making a data analysis. So all of us present here today, we'll start making the analysis by using the AI. And with my 13 years of clinical practice and thousands of cases what I have in Bible, I have started making use of AI with meridians, Ayurveda, diet, everything. I will demonstrate that to you, all of that today. The beautiful part is it is a complete learning process. There is reasoning, of course. It's a continuous a mechanism where it's like you're sitting with a specialist and trying to ask, see, this is okay, this is what you have given. Now, what about this? So it understands and it starts answering you like a human. like an assistant with complete knowledge of the subject. Obviously, when you're making a AI, data is compulsory. So here, artificial intelligence is not going to be of any use to you in collecting the data. So the scans, the calibration process, you are supposed to do by yourself. So don't expect the computer to do all automatically. The process of calibration and taking the scans is done by a clinician. We do that, right? Then we have a program of training the machine. Your computer knows nothing until and unless you train it, until and unless you tell it, right? And then it starts giving you the results. But the beauty of training the machine is, let me tell you that today, in today's world, AI is completely trained. It has knowledge from all the fields, all the angles, and how quick it can analyze the data is something, I will show you, and with the demonstration it becomes very, very clear. So we need to now assess a lot of data, and these data can be assessed within seconds. Can you imagine that in a clinical practice, what we are doing, we take minimum of 2 scans, 3 scans, and 4 scans of a patient, and then you have to analyze all of them one by one. And then you have to summarize the results of individual reports. And then you have to come to a conclusion that this might have be the condition of the patient's symptom. So, it's not an easy job, right? It's a laborious job what you're going to do with 4 and 5 scans. Sometimes it may increase. So obviously, let us move ahead with these slides. Let us pay concentration on Bible. Okay, what is this? Timeline. Okay, this is all available, timeline. And why I have kept all these slides is because it shows that AI is being used in the health sector, wellness sector, in medical field completely. It's now taken over, and no more people, they are more relied on this. And big hospitals, if you go, you will see doctors and nurse or assistants having a tab with them, and every detail you get, the BP parameter, the pulse parameter, or any parameters which are derived from the patient are fed into the AI. And immediately it says, oh, this might be the reason why this is shooting up. And it's being used in oncology. It's been used in eye, opticals. So especially in deciding with the retinopathy cases, diabetic retinopathy is a very complicated system, and it's now a part of it. AI is part of it. So anything you want to know about diabetic retinopathy, it is ready-made available to you. You don't need to train the computer anymore. It's already available. Then you see your Google's AI Eye Doctor, a very well-known application, and hardware. Its retina scans are known among the world. So this is the best AI usage, and we all use this, isn't it? We all use the iWatches. iWatches have now AI, and of course they can detect arrhythmias. They can detect plenty of cardiac conditions, and like you can see there, it collects data such as heart rate, sleep cycle, very, very important parameter, breathing rates, activity levels, and of course the blood pressure, risk of heart attacks. Everything can be now analyzed by using AI. And of course, in medical field, if you take the diagnosis part of it, in medical imaging and diagnosis, AI plays an important role. All of you can just drag some X-ray. Okay, people, like for example, when they come to my clinic with some back pain or knee pain, they always come with the X-ray. And how many of us can know how to read an X-ray? We don't even know. And AI is already being trained to read the X-rays. So as a clinician, I take the image, I give it to AI, and immediately, it can tell me whether there is any dysfunction, there is any fractures, there is any hairline cracks, whatever it is. It gives you the understanding. So AI is being used not only in the preliminary stages, but even in the advanced sections of MRI scans, we use AI now. And recently, hospitals in Mysore, they are all coming up with AI reporting system. I'll show you some of them as well. So this is again in medical diagnosis. So we are already utilizing the AI. Okay, these are all the studies which have been done. So we'll straight away move ahead. Assisting in healthcare. This is where AI is going to be useful for a clinician. All of us, when you take a scan, we need to derive, we need to come to a conclusion of what has happened. And at that particular stage, we will be requiring assistance. I've trained many of the students, and in some cases, what happens, they always call me. They say, okay, see, this is a scan which I've got before and after, or 3 scans, 4 scans, they send me. And they say, what could be the probable reason, or what could be the probable finding in this particular data, in this particular scan. So there I take the assistance of AI. Of course, it's in self-care, clinical advice, and several other aspects. AI is now being integrated, and more important, managing our data. But our whole concentration is using this artificial intelligence. Can I make a meridian analysis? Is it possible? Can I make a correction in the diet system of the patient? Can I try to understand which organs or systems of this particular patient is under stress? And all this based on the reports, what you have got from Bio. So artificial intelligence, Bio reports are going to be interpreted now by AI. We started by telling that understanding Bio reports is a challenge. It's not that easy. Interpretation is not that easy. You cannot simply look at a report and say, oh, this is high, this is low, this is how we have. No, there are multiple parameters involved in that, right? And we are going to look into each one of them and then try to understand if we can all make use of this AI in our reporting system, right? So what are the biggest advantages what I can have with this? First and foremost, today's topic, I'm going to talk only about the parametric analysis. Though you know that we make two analysis in Bible reports, we make the parametric analysis, you can make the visual analysis. You all know about that. So today, let's focus on parametric analysis. Very, very important, right? Now, first and foremost, if you have 4 scans of yours of the patient, you know how much of data is collected from Bible? It's huge. Huge data is collected. Huge parameters are calculated. And then it is analyzed in a way and shown in a graphical manner, in a visible manner to us in the software. But is it analyzed? You are supposed to analyze it. This is a graphical representation of stress levels. How do you analyze that for a particular patient with the presenting symptoms? Now, the biggest challenge is 1 scan I can read, 2 scans I can read, I can make a note of it. But if it's multiple scans, multiple record, how are you going to compare them at once and try to understand what has happened in subsequent scan? Most of the many students, many users of Biovel, they call me, they say, sir, you say that Biovel is very stable, but I take a scan now and I take a scan after 5 minutes. The two results are different. Obviously, it cannot be same. It is not only physiological, it's also psycho-emotional. So psycho-emotional parameters are always to be taken into consideration. So I always guide them. Whenever you take a blood report, whenever you take any of the biochemistry reports, you make second report and see if you get the same variables. The variables will always change. The biggest advantage, what I want to know is the derived Okay. I'm sorry, there is a slight disruption in the power supply. I'm connected with my laptop now. So if I can be permitted to share the screen, or the existing presentation is to be stopped. So we'll do that. Yeah, it's okay. I got it. I think I'm here. Okay, we were here. I'm sorry.
Yeah, all good,
There
all
was
good. We just don't
yeah.
see the video, your video. We see only the presentation now.
Okay, well, my video is again there. There we
Ah, here you go.
go. So fine. So derivation of the meaning of the report. So whatever reports you have got, how do you derive the meaning of that? What does that understand? On connecting to multiple branches, as I told you, Bible reports can be connected to chakras. It can be connected to meridians. It can be connected to Ayurvedic systems, and it can of course be connected with the teeth and meridian system in the body. So immediate connections with multiple systems is possible. And you can also get immediate recommendations by using the application. Now, I will tell you how exactly it can be utilized, it can be done. And before doing that, let me open up my Bible scan. I will show you one important place in Bible scan, which we all have to concentrate, and that where you're going to get all the necessary data. Okay, you're going to get all the necessary data. Now, this is the Bible application, as you can see. And here, let's say that these are the 4 records of the patient for which I have to do the analysis. Now I put them to compare, and when you come to compare, probably this is what you're going to see. There are 3 scans, and this is a compare report that you're going to get. And all of you, please observe that there is one column, one tab called as export to CSV. So this is a very important tab in compare. Maybe it's used more for statistical data or any research purposes, but now you all can make use of it. You are going to get a CSV file.
Gururaj, we don't see your screen. We don't see your screen. Gururaj.
You don't see the screen?
No, we
Excuse
see
me.
previous screen with Bible
Okay,
device.
can you see this? Can you see this?
Yes, now yes, absolutely.
Yeah.
Thank
Yes.
you.
Okay, this is the compare screen where you have the export to CSV file. So you're going to get a separate Excel file, a CSV file, and this CSV file is going to be very useful. Why you have to do this is because, as Dr. Koretkov in his presentation told, that there are Bible API now available. Till the APIs can be utilized in your application and you can get the data. This is how you will be able to export the data from Bible directly, either the AI, artificial intelligence API, or the Bible API. In either way, it cannot be integrated. So this is a one tab which you all have to concentrate and see to that you're exporting the data to CSV. It's a simple file. Immediately you're going to get on your system. Now, I'll show you the file. And I can come back to presentation later. So, okay, let me do it live. So I take the export to CSV and I take the file there. So there you go. It's in desktop. Hopefully it should be present here. Now, this is a file which I'm talking about. You see, it can open in your Excel application, but do not be frightened with the amount of data. It's a huge data, huge data. And I'll tell you, with 3 scans or even 1 scan, you're going to have around 1,565 rows in it. Do not worry about it. So now my whole goal is analyzing this Excel file. And this Excel file can be easily analyzed by artificial intelligence. It can be, it's the best data analyzer, I can say, right? Now, how do you use it? First thing, paid options are available. You can buy the APIs, ChatGPT is available. You can buy the APIs and you can do that. But let's go with the free. Let's go with the more, user-friendly way of doing it. Once you have this file with you, you can straight away simply export it to a PDF format. I'll tell you why. What is the benefit of PDF format? PDF formats can easily be analyzed by API, by what we call it as chat PDFs. So here you go. The PDF is open in the Microsoft Edge. Now this is a browser. Universally every application will have, every system will have a browser. So the same file is now open in the form of PDF in Edge. Why I choose Edge is you can choose Chrome also, but Edge gives you integrated artificial intelligence analysis, especially ChatGPT version 4, which is usually a paid application. It is free with Edge, right? So here, if you see on the top in the Edge there, it says ask Copilot about this file. Now this all what you're supposed to do is just come to your Copilot and there you go. You have the application ready, right? And sometimes if you want, you can go in for a pro version of it, which can give you more stable or more, appropriate results. So here you go, Copilot Pro, or even with Copilot, you'll be able to get the results. Now, how are we going to do the measurements? How are we going to understand what artificial intelligence can do? For this, we usually, I also trained my students in this to find out with the data analysis part of it. So I trained them. So we have covered what is called as masterclass AI for Bible separately. And here you see, we have generated certain chatbots and we also have prompts. For example, I am a meridian expert, so I would be more concentrating on meridian diagnosis. But first, universally, let's look at chakra analysis. So what is this which is getting copied? What is getting copied is the chakra analysis. That is prompt to derive the data from this particular PDF, find out about the chakras, all the chakras, and then it has to give its analysis. So this is a prompt, which is written with the help of prompt engineering, and it is going to extract the data from the file what you have derived. From the file what you have derived, remember that this file has 3 scans. It has 3 instances, 3 scans. So here, if I give this prompt to the Copilot, now the artificial intelligence will start functioning. It starts reading the data. Now, biggest advantage of Copilot is that your data is completely safe, right? Here you go. Now in chakras, if you need to know about the alignment, asymmetry of individual chakras, whether it is extrovert, introvert. So it makes the analysis completely. And then you see it's mentioning the chakras which are deviated from norm, which have maximum deviations with respect to alignment and also with respect to its asymmetry, whether it is, introvert or extrovert. So you have the complete, here you go. Anahata shows a strong right side deviation introvert in the second measurement. So it is deriving this data from the PDF here. You got a report, and this report can be exported to Word or to any other in the PDF format. And usually in my clinical practice, I give it to my patients so that it can be helpful to them in understanding about these chakra measurements. Now you see, this is not all with AI. Now with this particular chakral alignment, what recommendations can be given to the patient based on the report, based on this chakra position? What recommendations can be given? So this is the AI. So I can always go ahead and continue with the reporting. Now already I have got the report about the chakras. Now I will ask recommend, and you'll be surprised to see recommend proper diet to the patient or the person, however you feel like that the patient, so that these chakras are more aligned. Right, so it's going to again look into the data, and then it says it's going to give you a proper diet. And let me tell you, we are not the dietitians. We are not dietitians. We are not. We don't have any expertise in dietitians. We should always recommend the patient to go to a dietitian. And you know, chakral alignment is possible with probable food. Just with probable food intake, it is possible. And this is a recommendations what you can get from AI. So you see the benefit of scanning, benefit of getting the reports from all the 4 scans. It compares all the 4 scans and then gives you the analysis, gives you the report based on alignment, based on asymmetry. So it says Swadhisthana, Anahata, and Sahasrara. So these are the ones which are prominently seen to be affected. And based on that, it recommends also. You can see for my clinical practice, I use Guasa and terahertz therapy. So for your clinical practice, you can start using your own therapies, what you do. So with that particular therapy, how it can be corrected. This is just for chakras. Now, if you can see, I have done only for chakras. Now I come back to my masterclass and I say, make a meridian diagnosis. Now, because I am a meridian therapist, and you know, majority of my cases, I make the meridian diagnosis. So I just copy and paste the prompt one time. And then now what it's going to do, it's going to measure, it's going to extract the data of all the meridians. One is the energy value, second one is the balance. Very important parameter, energy value and balance. And based on the energy value and balance, it will tell me which of the meridians are not normal or which are deviations, either in energy or in the balance. And out of these 3 scans, where all these repetitions has happened, and depending on that, it's going to create a report for me. So I'm just going to submit the prompt, and automatically it's going to study my report. And based on the study of the report, it's going to prepare the data. There you go. And it usually takes very few seconds. You see there, it's deriving the data. 1, 2, 3 is scan 1, scan 2, scan 3. And it says immediately which is normal, which is not normal. And now the best part is, after comparing all the 3 scans, it's going to give me the analysis saying which meridian is 100% deviated from in all the 3 scans, in 2 scans, and then line of treatment, line of therapy, line of correction, depending on diet, depending on the type of therapy which you are going to give. There you go. The lung meridian, large intestines. Okay. So it gives the occurrence in all the 3 measurements. And then it says the lung meridian, the patient may experience respiratory problems such as cough, asthma, bronchitis, or shortness of breath. They may also have dry skin, fatigue, and sadness. So these are some of the few findings which the patient may have. Now we have to, of course, look into the symptoms from the patient and then get into the details of it. Which one would be more appropriate. And then it gives you the treatment plan. So what is the treatment plan you can give based on GOSA or based on terahertz frequency? And also it says the points where you can concentrate. Look at that, LU9, LI4, SP3, HD7, ST. So it's giving very good findings. And the best part, what I like in AI is the diet restrictions. So this is something as a therapist, as a practitioner, we have to induce into the patient. We have to tell the patient, you can take this diet, you are supposed to avoid these diets based on the existing condition of yours. So the patient may need to follow a balanced and nutritious diet that supports the health and meridians and organs. The avoid foods that are cold, spicy, greasy, or processed. How did it come to know? Depending on based on the meridian values, based on the meridian deviations. So the patient is supposed to avoid that. So you can tell them that these are the foods which is to be avoided. And a comprehensive report is generated by AI automatically. And then you can give this reporting to the patient as well. So making use of artificial intelligence in understanding the parameters is very, very useful. One of the biggest challenge, as you all know, if you come to Bible, if you see in the Bible, so when you come here, one of the most important programs we look into is our energy diagram superimposed with, the area diagram. We look into this diagram. What does it indicate? It indicates the intensity. We say whether the intensity of a particular region is above the average intensity for 10 fingers, below the average intensity for 10 fingers. We need to find out depending on the gap. Okay, depending on this is only an indicative program, please. So we use this program every time, and we make analysis based on this, looking at if it is really touching, then it's not a good sign. So there should be immediate concentration what we have to do. Now, can artificial intelligence derive this? Can it come to a conclusion that yes, these are the sectors in this software, these are the sectors which you need to pay attention, because the intensity levels are varying in 3 scans, 4 scans, 5 scans, how much ever you give. Now, the best part, what I liked is, in my program, we have generated for the very first time what is called as intensity for multiple scans. So, the data what you have has the values of intensity, average values of intensity. So you can make use of the average values of intensity, of course. And then same thing, you just have to run the prompt. And this time, we are going to look into the intensity part of it. And it can do a wonderful job. And I know it's a tedious job. It's too much of data is to be studied, but it does quite comprehensively. It's going to find out the instances, all the 3 instances, and intensities. As you can see there you go, energy 1, energy 2, and energy 3. It's calculating. Okay, I have put the meridian one, sorry. So let me come back to intensity. Copy this. Right. There you go. So it's now going to work with intensity, and intensity for n number of scans. So you can have 3 scans, 4 scans, 10 scans, but the data is going to be very high. There you go, intensity 1, 2, 3, and it's calculating for left thumb, right thumb. All this data is being derived from the same Excel sheet, which is converted into your PDF. And there you go, average intensity and differences. Differences you see epiphysis, duodenum, right part of the heart, coronary vessels. So it's going to calculate and give you the instances. Instance 1, 2, 3 means scan 1, scan 2, scan 3. These are the things what I have found out. And if you see, epiphysis seems to be constantly having in all the parameters. So you see whichever parameter is given there, so it's going to work with the intensity part of it. So intensity values are calculated and it is also presented scan wise, individual scan wise. So the biggest advantage what we have seen with artificial intelligence is when you compare multiple data, when you're actually comparing multiple data, the multiple data is going to give you the reasons, the values, and these parameters can be utilized with the artificial intelligence to derive the necessary reports. Now, the biggest of it, you don't even require this, right? Sometimes you know that clinically you're very strong and you have a strong knowledge on meridians. Then what do we do? You can simply open up any of the, let's say, I can open up, I'll just close this. Clear some of these. So you see, I just open up Copilot application. Anybody can open up. You can just open the Edge or Bing.com. You get the Copilot, which is free. Now you have looked into the analysis. You have looked into the Bible software, and you found out that few of the meridians are deviated or they are affected, or few of the organs are affected. Let's take one example. So if you come to area diagram, and here you see, I see some weaknesses in the colon, descending colon, sigmoid colon, and rectum colon. This is only one scan which I'm talking about, right? Now, colons are weak. What do you understand by when the Bible report says that colons are weak? What could be the probable condition? Because, for a medical doctor, it is very easy to analyze with organs. But for a therapist, he has to look from different parameters. Is it related with psychology? Is it related with organ itself? Or is it related with his diet, hydration? So multiple parameters will come into picture. So in artificial intelligence, you can simply do this. You say that according to the bio well scan. Why do you have to write bio scan? Because see, you're teaching the AI. The AI needs to know from where did you derive the data. The context is very important. So when you say according to Bible scan, the colons seems to be having weak I say weakness. Yeah. What could be the probable symptoms? Now, you see, this is some of the very important thing. How do you study? How do you interpret a Bible? Whenever you see a weakness in the Bible for concurrent scans, then you need to understand the patient, what symptoms he may find. Let us understand that BioWell can detect the problems well in advance. You don't need to go to symptomatic conditions. The patient need not be in symptomatic conditions. Well, in early stage itself, it's possible for the Bible to detect it because it is psycho-emotional in state, obviously physiological conditions, and the water content. All these three parameters are important. So in future, in coming days, the patients may show up with some symptoms if it is not changed. So you just have to tell AI and I guarantee you that AI will give you, look at that, immediately. It gives you the details. And it is not that, it's not that the information is not present. The complete data is present with AI because there are multiple millions of people using across the globe, and every person using is improving its knowledge. So there you go. So what all could be possible? So you have this as a symptom which you can unearth further, right? And for a meridian expert, anybody in meridians, if you say that the lung meridian is weak, what does that mean? So you say probable symptoms. So you get the symptoms. So this is where it's going to be very, very useful for us. And ordinary, if you go and type for any medical diagnosis part of it, the Copilot will not give that. You have to give the context of bival scan. Without the context, it will not answer. So there you go. You see, depression and sadness is an emotional being. It's an emotional factor. So we get all the details from AI. Now, the biggest advantage where this came to us was usually the patient comes to us for a scan. So we do multiple scans and the patient says that we definitely ask the patient, are you on any medication? Are you on any medication? So, the patient will say, I am on ABCD medication. So, for example, he says that I am on melatonin. Now, immediately you don't know what is melatonin. Please make use of AI. And with AI, you know exactly where this drug is given, for what purpose it is given, and you also know that what will be the weakness in the patient. So, making use of artificial intelligence in our clinical practice makes our life very easy. And with BioWell, you can make a very good interpretation with AI. And of course, we have the master classes where we have dealt with so many challenges in interpreting the BioWell report, and of course, advancements now with the doshas and others we are going to include. But one caution I want to give, please. It is not that AI is supreme. We have to take it as a caution. It needs human surveillance. It needs therapist attention. Therapist should have the basic knowledge, right? It may, it doesn't understand emotions. It's a machine, and machine doesn't understand emotion. BioWell is a particular device which can measure emotions. So emotional factor or quotient will be missing. So you need to add up from your side. Inaccuracies are still possible. It's not that, everything is 100% fine. But along with this, definitely you have real advantages. So provides real-time data. Very easily you can achieve your task. It doesn't take much time for the reports to be generated. And of course, it acts as your assistant with total knowledge of all the subjects around. So it's your assistant, and I have been, and my students have been making use of this assistants across for plenty of few months now. And of course, we have generated several reports, which is easily readable by the patient. Patient can understand that, we can understand that, and we have unearthed several secrets from BioWell reports just by using artificial intelligence. It's an open platform. All of you can make use of it. And I really thank Dimitri and Dr. Gururaj for giving me an opportunity to put this on this platform. Thank you very much.